Cardiac Surgery, Patient Pre-Op Booklet, Part 4, Cardiac Rehabilitation. Cardiac rehabilitation. Heart disease is the #1 killer in America, despite advances in modern medicine. If you or a loved one had a recent cardiac event or diagnosis, the best way to recuperate is through a rehabilitation program that combines monitored exercise and healthy lifestyle education programming. Northern Light Cardiac Rehab can provide you with the support you need for a successful recovery and a lifetime of healthy living. Most patients who meet the qualifications are referred to cardiac rehab prior to discharge. Most cardiac diagnoses are covered, including PTCA, a stent, heart attack, heart surgery, stable angina, and stable heart failure. So this is just like one graphic I found. So less than 20% of patients eligible for cardiac rehab are referred to the program. Cardiac rehab cuts risk of repeat heart attacks by 15 to 20%. 470,000 Americans have a repeat heart attack each year. Cardiac rehab participants have as much as a 35% lower death rate than non-participants. So these are some of the core components of what you will expect from cardiac rehabilitation. So this includes patient assessment, nutrition counseling, weight management, blood pressure management, lipid management, diabetes management, tobacco cessations, psychosocial management, physical activity counseling, and exercise training. So these say some of the benefits of cardiac rehabilitation. So it lowers the chance of a second heart attack or heart surgery, reduce overall risk of dying or having a future cardiac event, it lessens your chest pain, help with weight loss, and control risk factors of high blood pressure and cholesterol. Once a referral is received, you will be contacted by a member of our team. Staff includes registered nurse, exercise psychologists, and dietitians. Our secretary will schedule an appointment for you to visit the program. Once you begin, you'll participate in monitored exercise and you will receive education on the following topics: nutrition, exercise, medications, and coping skills. You'll be asked to avoid overusing your shoulders and chest muscles because of your chest incision. This is to help your breastbone heal as fast as possible. Avoid lifting or pulling anything that weighs more than a gallon of milk, including children, grocery bags, suitcase, firewood, and the vacuum cleaner. Avoid weightlifting, avoid push-ups or chin-ups, avoid pushing or pulling heavy objects. Avoid swinging golf clubs, avoid lawn mowing, digging, wall painting, avoid driving a vehicle, avoid shoveling and snowblowing. You may do other activities that don't require lifting more than what a gallon of milk might weigh. However, this does not mean you should keep your arms still, as this will leave you with stiff shoulder joints. A heating pad or a warm shower can help relax painful or stiff muscles. Do not use a heating pad at night when sleeping, as this can cause burns. Alcohol. Usually 1 drink a day is allowed. Please check with your doctor first. Please remember, alcohol depresses the pumping action of your heart. It doesn't open the arteries of the heart. It can dull your judgment. It can also work as a sedative. It may work against the medicine you are taking. So this is it says usually 1 drink allowed, so this is the standard drink over here. So cholesterol. An important contributing factor to coronary artery disease is elevated blood cholesterol levels. You should be aware of your blood cholesterol level. It is a good idea for family members to be checked, particularly if you have developed coronary artery disease prior to the age of 50. You should work with family doctor to maintain a LDL less than 90. Driving. To allow for total healing of your breastbone, you should not drive until approved by your surgeon. Smoking. Smoking is one of the main causes of heart disease and will have a negative effect on the benefits of your surgery. Smoking will also impair your recovery from any surgical procedure. If you smoke before your surgery, don't place yourself or your new bypass grafts in danger by continuing. There are many programs that can help you kick the habit. Sexual relations. Sexual relations may be resumed as soon as you and your partner feel comfortable. At first, you may not feel comfortable having intercourse, and your partner may feel protective of you. Resume normal relations at your own pace. Sexual relations should be resumed in a familiar setting. Try to relax. If you are tired or tense, it may be best to wait. Wait for 1 hour after a heavy meal or use of alcohol. Foreplay may help you prepare your heart for this increase in activity. It is normal for your heart to beat faster and for your breathing to speed up during sex. They should slow down slowly afterwards. Positions for intercourse should be comfortable and relaxing and should permit unrestricted breathing. Use the position most comfortable for you and your partner. Feelings. Some days you will feel wonderful, other days you will feel tired and depressed. This is not uncommon after heart surgery. We encourage you to discuss your feelings. Research has shown that exercise is a good way to fight depression. So even though you feel down and out, keep your exercise program. Some lower level activities such as playing cards, listening to music, or visiting friends may help as well. As you start to feel stronger and better, these feelings will go away. If they don't, talk to your doctor about them. Heart valve patients. An artificial or abnormal heart valve can be a site for infection. For that reason, certain procedures require prevention antibiotics. Always tell your doctor or dentist you have had heart valve surgery prior to any procedure. The following list of procedures may require treatment. So dental work, any minor or major surgery, any procedure that can cause injury to soft body tissue. You may also be required to take a medication called Coumadin to prevent blood clots. If your surgeon prescribes this, you will receive education about this medication. Call your doctor if you experience the following: chest pain that is like angina, shortness of breath that does not go away with rest, occurs while waking suddenly at night, or occurs when you're at rest. Irregular changes in your heartbeat other than what is expected with exercise. Extreme weakness, perspiration, or paleness. Pain not relieved by medication, fainting, any cloudy yellow drainage from your incision, any redness, swelling, or increased tenderness around your incision, oral temperature of greater than 101 degrees Fahrenheit, weight gain of more than 5 pounds in 1 week, or problems coping with feelings of depression or fear.